guys, welcome back. In this video we will be discussing about antibiotics. If you are watching this channel for the first time, please do subscribe to our channel Dr.Medicine. In this video we will be discussing about a brief introduction about antibiotics, their classification, uses and misuses, antibiotic resistance, characteristics and their possible side effects. Introduction. An antibiotic is a type of antimicrobial substance active against bacteria. It is the most important type of antibacterial agent for fighting bacterial infections, and antibiotic medications are widely used in the treatment as well as prevention of such infections. They may either kill or inhibit the growth of bacteria. The antibiotics that kill an bacteria is called as bactericidal, and the antibiotics that inhibit the growth of bacteria is called as bacteriostatic. Now we are going to discuss about its classification. Antibiotics are usually classified in several ways based on mode of action, based on spectrum of activity and based on mechanism of action. Now we are going to discuss about the classification based on mode of action. Based on the mode of action, we classify antibiotics into two types. One bacteriostatic and the other one is bactericidal. Bacteriostatic means that the agent prevents the growth of bacteria, that is, it keeps them in the stationary phase of growth, whereas bactericidal means that it kills the bacteria. No antibiotics bacteria multiply. Bacteriostatic antibiotics prevent bacteria multiplying, and bactericidal antibiotics kill the bacteria. The examples of bacteriostatic antibiotics may include chloramphenicol, erythromycin, clindamycin, sulfonamides, trimethoprim and tetracyclines. And the examples of bactericidal antibiotics may include aminoglycosides, beta-lactams, vancomycin, quinolones, rifampin and metronidazole. Now we are going to discuss about the classification based on spectrum of activity. Based upon the spectrum of activity, we classify antibiotics into two major types. One is broad spectrum and the second one is narrow spectrum. Broad spectrum means that the antibiotics is effective against a wide range of bacteria, and narrow spectrum means that the antibiotics is effective against a particular group of bacteria. The examples for broad spectrum antibiotics may include carbapenems, chloramphenicol, third generation fluoroquinolones, second, third and fourth generation cephalosporins and tetracyclines. And the example for narrow spectrum antibiotics may include penicillin, lingosamides, glycopeptides, streptogramins and rifamycin. And now we are going to discuss about the classification based on mechanism of action. Based upon the mechanism of action of the antibiotic, we classify it into five major types. One is inhibition of cell wall synthesis, second one inhibition of functions of cellular membrane, and third one inhibition of protein synthesis, fourth one inhibition of nucleic acid synthesis, and the fifth one inhibition of folic acid synthesis. Here are the examples for each category. The inhibition of cell wall synthesis may include cycloserine, vancomycin, bacitracin, penicillins and etc. Inhibition of folic acid synthesis may include trimethoprim, sulfonamides and etc. And please go through the examples given in this picture. Now we will be discussing about the uses of antibiotics. Antibiotics are used to treat or prevent some types of bacterial infections. They are not effective against viral infections such as common cold or flu. Antibiotics should only be prescribed to treat health problems if they are not serious but are unlikely to clear up without antibiotics, such as acne. If that are not serious but could spread to other people if not properly treated. Where evidence suggests that antibiotics could significantly speed up recovery, such as a kidney infection. Advantages of taking antibiotics. Antibiotics can slow the growth of and kill many types of infection. In some cases, such as before surgery, antibiotics can prevent infection from occurring. Antibiotics are fast acting. Some will begin working within a few hours. They are easy to take. Most antibiotics are oral medications. Your doctor may decide to give you an injection if it is imperative that the medicine gets into your system quickly. Disadvantages of taking antibiotics. If you take antibiotics often, your body can build a resistance to antibiotic drugs, which could cause antibiotics to become less effective. The longer the course of treatment for an antibiotic, the more damage that can be done to the body's immune system. Some antibiotics can have side effects, from digestive issues to bone damage to sensitivity to sunlight. Make sure to read the fine print that comes with your medicine so that you know the risk. Inappropriate use of antibiotics is creating a huge threat to the health of the communities. Misuse of antibiotics. According to Centers of Disease Control and Prevention, up to 1/3 to 1/2 of antibiotic use in human is unnecessary and inappropriate. Antibiotics have been given for everything from headaches to ingrown toenail. They are swallowed, sucked, or injected and smeared. They are painted on cuts, dumped into wounds. Antibiotics do not treat patients. Antibiotics treat bacterial infection. In addition, antibiotics now included in animal feed, which are given to promote growth in animals. Many of these antibiotics are then ingested by humans through consuming animal products. The misuse and overuse of antibiotics has contributed to one of the world's most pressing public health problems today, called antibiotic resistance. What is antibiotic resistance? When an antibiotic has no longer an effect on certain strain of bacteria, those bacteria is said to be resistant bacteria. How does antibiotic resistance occur? High number of bacteria, but a few of them are resistant to antibiotics. Antibiotics kill bacteria causing the illness as well as the good bacteria that protect the body from infection. The resistant bacteria now have preferred to grow and take over. Bacteria can even transfer their drug resistance to other bacteria, causing more problems. Rational use of antibiotics. Rational use requires the patient receive medicines appropriate to their clinical needs in doses to meet individual requirements for an adequate period of time at the lowest cost to them. That means correct drug, correct dose, and correct duration. Consequences of irrational antibiotic use. Ineffective and unsafe treatment, more serious illness, longer recovery or prolongation of illness, more frequent hospitalization, increased adverse effects, more expensive treatment, loss of patients' confidence in doctors. Ideal characteristics of antibiotics. Antibiotics should be toxic to microbes and not to humans. They should be bactericidal rather than bacteriostatic. They should be effective against broad range of bacteria. Antibiotics should not be allergic. They should be active in plasma and in other body fluids. Desired level should be reached rapidly and maintained for adequate period of time, and should not give drug resistance, and they should be cheaper. Possible side effects of antibiotics. Although there is a long list of side effects, but some of them are listed below. Diarrhea, bloating, indigestion, abdominal pain, loss of appetite, being sick, itchy skin rash, coughing, and life-threatening allergic reactions. And that's it. Thanks for watching. If you need the presentation PPT, please do check the description box. Thanks for watching. See you next video.